Welcome to the Toke&Trans podcast, where two Toke&Trans guys talk life, love, and getting high. Grab a J and join us. We do not condone the consumption of illicit activities with anyone under the age of 21.
What?
I don't know. I'm like, wait, what?
Oh my God. Okay, so
what's going on, everybody? What is up? How the fuck are you guys doing? How are we doing today? Bro, how are you? Beau? Beau's got some news today to share. He
oh my God.
has some updates that he just has to share. You have to hear these. These are good.
I have some updates.
Mm-hmm.
So the last episode we talked about like my consultation process and all that stuff. Well, fucking like right after that episode, shit fucking picked right up.
Busy.
I got better with RSV.
Mm-hmm.
And
you can tell by his voice. Can't you hear his voice is a little better than last week? It's a little more.
I'm not sure. Yeah, I'm not sure if my voice is ever going to come back. It's still like really cracky. Maybe I hit puberty again. I don't know. I'm not mad at it.
I'll keep it.
So last weekend I started to feel better from RSV, and I was like, okay, I'm gonna call the labs and schedule LabCorp and schedule my labs that my surgeon needs me to get done before we can move forward. Now that I'm feeling better, I'm going to schedule it on Monday, which was the 30th. This past Monday, we're recording on the 2nd. So
we're trying to balance these dates between recording and publishing dates, but we're with
great.
you. We're with you. This last weekend.
So on the 30th, I went to LabCorp, got my labs done, and I called my surgeon to let them know that I did that so that they can expect the lab soon. And hopefully that will like streamline the process. Well, the 29th, that Sunday, I got a phone call surgeon's office asking me if I had gotten the labs done yet. And I was like, no, I was thinking of going tomorrow because I had RSV and I didn't want to go get my labs done and get anybody sick. So, but now that I'm feeling better, you're muted. Did you say anything?
I'm sorry.
Oh,
no, you're good. No,
I saw your mouth move and I was like, bitch, you're muted.
No, I'm sorry.
So she's like, okay, yeah, that's good. That's great. I'm glad you're feeling better. I was just calling to ask if you had them done yet because we have an availability February 17th. February 17th. That is 17 days away.
17 days. Like that's no time
in 2
at
weeks.
all.
It's 2 weeks from tomorrow. And I was like, oh, frick, that would be perfect because, I can't remember if I mentioned it in the last episode, but this year we're also moving. So I have to be able to lift and move and like use my arms by June. I have to be able to do that. So it was like, I had no idea what to expect. I was expecting several months to wait. So I was like, oh man, I really hope they don't tell me like June or May because I'm not going to have enough time to recover. I hope they tell me like August so that way I'll already be moved in and stuff. But February 17th would give me plenty of time to heal before moving, and I would have access to my arms and my strength. So I was like, okay, yeah, I'm gonna get my labs done on Monday. You hold on, honey. And so I got my labs done. I called them back and was like, hey, just to let you know, I got my labs done. I heard something about February 17th. So,
what up?
I love that. If
bad bitch, what up? Bad bitch, what up?
Right. So my surgeon's PA calls me back that very evening and is like, hey, so Dr. Hamidian said that we could just schedule you for the 17th. And I was like, did my labs come back already?
Did you even
and she was
get
like,
them?
Right. And she was like, no, we just, you said that you don't smoke cigarettes and you don't live with any smokers and you're pretty sure that you're not going to test positive for nicotine, right? And I was like, yeah, 100%. I'm not going to test positive for nicotine. There's no way.
Yep.
And she was like, okay, yeah, then that's the only thing that we're really concerned about with those labs. So we're just going to schedule you. And the lab should come back by then.
Mhm.
And if for whatever reason I don't test good or whatever in the labs, then we'll have to push the date back. But
yeah,
I'm not expecting anything. So fuck yeah. So your boy's getting his titties off in
They're
2 weeks from tomorrow.
Bro, I cannot be happier for you. I'm so excited. No one deserves it more than you, dude. And you've done a lot with your chest for the community. You've given it. The people have learned from it. You've changed lives with it. It's done its job. And it's now time to send it on up out the door and move the fuck on, you know? And I'm excited for you.
Yes, I'm so excited. I peed myself. She told me. I was like, are you kidding me? Like, what? This, I wasn't.
I'm sorry. My God. I thought you said that. Could you repeat that?
I'm literally getting my titties chopped off 1 month after my in-person consultation.
1 month.
I am. First of all, I want to acknowledge how fracking lucky I am, because holy shit, I was expecting 6 months, to wait.
Yeah. You're like, that'll be after we move. Right.
I had all of the fucking 2 weeks. Oh my God.
So what have you been doing? You've been doing a lot of research. You've been looking for the products that are going to be helping you through recovery.
Yeah, I've been looking around Reddit and stuff like that, and also a lot of my friends and followers have been really kind in sending me messages telling me like, well, you might need this, and you might need this, and you might need this. And so shout out to them. Asher and Alistair have been awesome, and everybody else who's messaged me, I really appreciate it. I've compiled like a list of things that people have said that I'm going to need, and put them in an Amazon, an Amazon list.
Yeah,
for like my friends and family to help me out, right?
Yes. Oh my gosh.
My surgeon also sent me with this neat little packet that just goes through everything, top to freaking bottom, like what to do the day, top to bottom, what to do the day before, like what to expect, what are the risks, like freaking everything. Yes. And then they give me another packet that's got like pictures of like exercises to do, and like how to put on a shirt, whatever, how to put on a shirt, and like how to do the spirometer and deep breathing exercises, because like
with actual like people,
breathing is like super important,
vital
after surgery, right?
Apparently, I guess is what they say. Bro,
did you know that you have to stop taking your hormones 2 weeks before top surgery?
No, I did not know that. Like, stop my shots.
That's why it says oh fuck, where'd it go? It says you will discontinue hormone therapy 2 weeks prior to surgery. Spironolactone is okay to continue. This decreases the chance of blood clots.
Interesting.
Yeah, so I'm glad I read this, because I would have taken my shot tomorrow.
They gave you that fat packet though for a reason, for you to go through.
Right, but they handed it to me and they're like, read this. Of course, I waited until yesterday.
Oh, what?
But well, I skimmed through it and then I forget everything, and
so we got to circle back and see what it said again.
Right.
Because you're
since it's happening in 2 weeks. And
2 fucking weeks, Beau.
A lot of these things are like, you have to quit smoking weed 4 weeks before surgery. And I'm like, I didn't have that kind of time.
Yeah, like I didn't have. That's true. Did it say anything about weed? Oh no. What is this? What is happening? I can't work like this, Aaron. Where can you hear me? You're frozen.
What just happened?
I glitched.
Oh, it's recording again.
It is recording again.
Oh, okay. I'm sorry for the glitch.
No, I glitched. Something glitched. I'm sorry. Were you talking?
I was saying that I'm smoking weed and I shouldn't be.
Yeah. Okay. So, did it say anywhere in there about weed at all?
It said, let me just go right to it. Let me just go right to it.
I need the facts here because weed's important to me. I mean,
here we go.
Oh, what it is.
Listen. Okay. Under this section, it says, do I need to stop smoking? Recreational drugs? All patients will undergo both an initial drug screen and nicotine test. And like I said earlier, it was fine that I tested positive for weed. It was nicotine that they were really worried about.
That was the big one.
Yeah. We are unable to offer a surgery date without negative test results. If these tests come back positive, except for marijuana, we cannot, it says except for marijuana. Mm-hmm. We cannot move forward with the surgery. Same. Oh my God, I'm fucking high. Okay. We cannot move forward with the surgery scheduling process until repeat testing is negative. Quit all nicotine products, smoking, vaping, hookah, chewing tobacco, nicotine patches / gum, certain rolling papers. Like if you roll blunts, I suppose. Mm-hmm. And avoid passive secondhand smoke exposure for at least 1 to 2 months with documented negative nicotine screening test before scheduling surgery. It has been well studied that nicotine increases the risk of wound complications and infection, which can have a significant impact on your surgical outcomes. You should remain nicotine-free for at least 2 to 3 months after surgery. Active substance use disorders need to be accurately assessed and managed with at least 6 months free of use before surgery can be scheduled. So if you regularly take something,
right,
then that needs to be addressed. But I did talk to my doctor and tell them that I take LSD sometimes. Mm-hmm. And I told him how frequently, like 3 times a year. And they were like, okay, yeah, just don't do that anywhere near around the time of surgery.
Yeah.
And you know, it's fine. So just be honest with your doctor for sure.
Tell them what
and then, right. And the last thing it says is marijuana is okay. We recommend no smoking / inhaling anything 4 weeks before surgery and recommend edibles instead. This is to decrease the risk of lung / breathing complications during surgery. So I do have some RSO and I will be taking that.
Yeah. So your plan is oil instead. Is that true?
Right. Yeah.
Okay.
Yeah. So I have that. And I also have some, I have a PAX, like a dry herbal vape, you know, mm-hmm. And my partner can smoke some herb in it. I won't. Mm-hmm. And then I collect the already been vaped weed, and right. I just kind of put it in a smoothie and I eat it and it gets me high as balls.
Yeah. I've seen you have those smoothies before.
Yeah, it's fucking.
They look delicious, bro.
First of all, they are.
They look gore fucking May. Okay.
I go ham with my weed smoothies.
Oh, bro.
I do.
I'm gonna need to. Yeah. See that I'm concerned about this, like top surgery, like this is a big deal. Like this channel, like you guys know, we like our weed. We like to smoke our weed, and we're both getting top surgery. That's both gonna happen. So we're kind of like reevaluating. I am a regular bong smoker, so this it's like the only thing that I prefer. So I'm gonna have to. I mean, I even had RSV, and I was like, didn't give up the bong. So
that was fucking astounding to me.
I can't. I love it, and so I'm not gonna be able to be inhaling or dealing with the smoke. So I'm gonna have to get some recipes. I'm thinking smoothies. I'm thinking, because I can drink smoothies all day long. Like I made shortbread cookies, and those were good, but you can only eat so many shortbread cookies. Like,
oh yeah,
a day for so many days.
Sip on a smoothie just all day. Keep growing in the fridge and taking some. There's fucking high all day.
You can pretty much have anything and put weed in it. I didn't even know that.
Anything.
You could have dinner. Yeah, you could put butter on your roll.
Yes,
and that will get you high.
Yes, you could infuse your fucking ham if you wanted.
Your ham. Oh my god. So yeah, I'm gonna be exploring that for sure.
Yeah.
So your plan is the oil the whole time, right?
Yeah. I mean, an RSO, fuck, man, that shit fucks me up. Yeah, and smoothies. I love smoothies. RSO gets me high as fuck. The first time I took it, okay, listen, I have a pretty high tolerance, especially when it comes to edibles. It seems like I always have to eat like 3 times the amount as a normal person, whatever that is. I guess average person, I would rather say, for me to feel anything. Right. And my boyfriend even thought it was bullshit, but that I would take the same amount of him, and he's like, a half hour later, he's like, "Oh, I'm high," and I'm like, "Good for you,
cool, bro.
That's awesome." I'm not.
Oh my gosh.
Yeah, so he finally understood, like, after I took fucking 3 times as much as him, and then I finally got high. He's like, "Oh wow, like for real." So that's what I took, that knowledge I took with me. And you saw me at Levitate. I ate like 2 whole candy bars when it was like serving size, 2 pieces.
Bro's on the phone with me trying to tell me where we are at the beach. And I'm like, where are you, Beau? Where are you at? Like, we're down here on the corner of blah, blah, blah. I think you're like right. I think they were like a block away from us. I just didn't know which block direction. So I was like, Beau, so where are you guys at? And he's like, like laughing in the phone. And I was like, bro, hello? I'm hello? Like, where are you at? And he's like, bro. And I'm like, what, bro? Where are you? I'm in like a crowded car on the beach waiting. And he's like, my edibles are dropping. He starts laughing so hard, and I'm just dying laughing in the car, and everyone's like, what? Why are you laughing? Where is he? Like, what street is he on? And I'm like, I said, I don't know. He just had his edibles dropped. So I think we should try this way.
Oh my God.
So now every time, that's how we just refer to it that way.
Oh fuck. I have no recollection of that.
Of course you don't. You had a great time. Do you remember the beach? Do you remember being at the beach?
I remember being at the beach.
That's meeting
okay. Julian.
Yes. That was great. That was awesome. Yeah. What would you say give me like your top 3, like, well, what are you nervous? Is there anything you're nervous about?
Oh my God.
Like, Aaron, what are the top 3 things you're nervous about? Like, real talk,
so glad.
Worst case scenario, like, let's just get it out there.
I'm so glad you asked. Because when I was reading through this packet, my blood pressure went up. I started sweating. My stomach, my heart, I was fucking like, I had to grab the table. I was like, ooh, we gotta ooh, we gotta calm down.
Well, what was it? Well, that was hyping you up.
It was this part. Where is it? Oh, it was the day of surgery.
Mhm.
Fuck, man. See, I'm such an empath. just empath things, but like when I'm reading something, I'm like there. You know what I mean? Emotionally, I'm there. I know what the hospital looks like.
Mm-hmm.
So I'm like, I'm reading this and kind of dissociating at the same time. And like, kind of, I'm like at the hospital, and it goes through such detail.
Yeah, of what's to come, right?
Right, exactly what's gonna happen. Right. So, which is great. And I'm so glad they did that. But so I'm just like, so I'm in the hospital. And I'm going to go in this room. I'm going to take my clothes off and put on a cap, a mask, a gown. And I'm going to lay down. And they're going to put an IV in my arm. And they're going to give me something that's going to relax me. And I'm like...
Okay, I can see how that would start to make you a little bit nervous. You're like, okay, now this is... It went from like, this is never going to happen for me, to like, this might be possible for me, to like, this is next week.
literally and I'm freaking out, honestly. Like,
it's like a roller coaster.
Such a roller coaster. Oh my god. Ooh, I need to take a drink of water. I'm sorry.
You can go. Cheers.
Cheers. It's the hydrate hose.
Hydrate. If you're listening, hydrate right now. Hit the hydration. Hit the
hydration, homies.
You already know our mouths are dry from smoking this weed anyway.
Right. So, oh my god. Oh, and this is another weird thing is in the day of surgery. I'm just going to read through the whole thing.
Okay.
So, day of surgery, before you leave for the hospital, this is in caps. Do not chew gum after you leave your home on the morning of surgery. What?
Bro.
I can't chew gum?
But you can before you leave the house, but not after.
Not after you leave your home on the morning of surgery. It's, you know, if I feel like if it would matter so much that it was on the day, they would just say, do not chew gum on the morning of surgery.
Day of, or something.
Right, or like something that would be way more general than that. But they added the specificity of after you leave your home on the morning of surgery.
How do they know how far my commute is? Like, that's going to depend. You know what I mean? Like, that's going to be like 12.
Like, so I better remember to brush my teeth.
That's interesting. You have to sleep with a fresh... All right, well.
Right. So, wait. Actually, I'm going to go before. I'm going to start
Is the gum something that is a big concern for me as well? Is that going to be...
No, I don't really chew gum because I have temporomandibular jaw disorder.
Well, I was not expecting
that. So I can't really chew gum because it hurts my jaw. I like it'll pop out or whatever. So
you're good to go.
Yeah. So I'm actually gonna start reading on the day before surgery because I think some of it like matters. Okay, so they gave me these wipes.
These grapes.
These wipes. They're called Ready Bath bathing cloths. And they gave me 2 packets of them. And they says, you will shower the night before and on the morning of surgery and use a chlorhexidine wipe to clean the axillary area, armpit, chest, abdomen, and the groin. If you do not have wipes, please purchase 1 bottle of Hybiclin soap. Lather and shower, leave on body for 5 to 10 minutes, and rinse off. Hybiclins typically costs around $10 and is available in most drugstores. This reduces the risk of infection resulting from surgery. So that's what these wipes are, I suppose. They're Hybiclins wipes. And they gave them to me to do that. So I have to take a shower the night before and wipe with these, and the morning of and wipe with them. Nothing to eat or drink after midnight. And this gets very James Bond. So I know the day of my surgery, but I don't know what time. And this is what they said about that. You will receive a phone call between 3:30 p.m. and 8 p.m. the day before your surgery to provide you with an arrival time the next morning. If you do not receive a call by 8 p.m., please call the operating phone number. Like, how James Bond is that? If you don't
call me by 8 p.m. on the day of my surgery, I'm going to be livid. I'm going to be pissed off, bro.
It would be the day before that they would call me at 8 p.m. Oh, okay. But yeah, they said from the hours of 3:30 to 8, I should expect a call, and then they're going to tell me what time to show up the next morning. So I guess that's too a lot for because I'm not going to be the only surgery that day.
Right.
I was already told I'm probably going to be the second surgery that day. So that's probably too a lot for everyone's surgery. Sure. Maybe the guy before me takes a little longer.
The extra 30 minutes. Yeah, that's right. Yeah, I see.
So that's probably why. And I like that because then, I mean, I would rather my surgeon not have a time and just get to me when he gets to me,
Yeah.
Instead of being like, I have a 2:30 appointment, and then he's rushing through this guy's surgery or something because of a number he saw on a schedule. It makes me feel better that he's not being confined by that.
Sure.
So okay. So and then it says, do not smoke, drink alcohol, or use recreational drugs, marijuana, cocaine, etc., for 24 hours before surgery.
Mm-hmm.
So see, this is where I'm like, could I partake just a little, maybe, as long as I don't smoke 24 hours before?
So wait, so we could. So they're trying. All right,
is this a loophole?
Can you say this again? tell me the rule
so
again.
Concerned.
Tell me the rule again.
So before the rule was, hold on, let me find it. Hold on, where is it? Where'd it go?
As long as it's edibles.
Yeah, it said, fuck, where'd it go? Stop smoking, where'd it go? Oh, here we go. It says, we recommend no smoking or inhaling anything 4 weeks before surgery and recommend edibles instead. So they recommend
all right,
that you don't smoke 4 weeks before. Okay. And they recommend edibles instead.
Okay.
But when you get to the day of surgery, do not smoke, drink alcohol, or use recreational drugs, marijuana, cocaine, etc., for 24 hours before surgery. They don't recommend it. They say do not. So,
like you would have to just not the day before.
Yeah, do not
smoke.
Do not smoke the day before. But they recommend not smoking for 4 weeks beforehand. So, it is the hospital and the doctor recommending. I do have asthma, and the risk of smoking during those 4 months is a breathing complication during surgery. And I do have asthma, so I would be an idiot to keep smoking.
I see.
I'm not going to be smoking anymore after today. I want to make that clear.
Okay.
I'm smoking for today. I'm very anxious talking about all this and going through this package. Judge your mama, okay? Don't judge me.
No, I'm happy that we're going through this packet, and I feel like this is the best way to go through it. Together, high as shit, Yeah,
I agree. I need the support.
Yeah, I feel like we got that there.
Which it also says in the packet that you need. Listen, okay, so the day of surgery. Before you leave the hospital, do not chew gum after you leave your home on the morning of surgery.
Noted.
Clothing and jewelry on the day of your procedure. Do not wear makeup. Excuse me. Do not wear makeup. Do not use any form of hairstyling product on the day of your procedure. Do not wear hairpins or hair pieces. You must be able to lie flat. Do not wear contact lenses. Remove nail polish from at least one fingernail.
That's a good one. Beau, I want your theory right now on what that is. Why?
I have no idea.
You have to come up with a theory. Why?
I have to come up with it. Why would they need one fingernail?
That doesn't make
uncovered.
Sense. Like, is it the acrylic? Like,
no, I don't think so. Because it does. It says remove nail polish from at least one fingernail. Well, they have to be. You know what? It probably is. It probably is circulation.
Oh, so they can see.
Like when you when you squeeze your fingertip.
He did fucking know. He did fucking know exactly what the fuck.
Stop. Okay. I took sports medicine.
Ooh, education.
So that's how you check to see if someone's circulation is like you squeeze on their finger and then watch how fast it gets the color back.
So
and I guess if you have your nails painted, they can't really see how pink your fingertips are. Yeah. So
how about that?
I guess that makes sense. But it really sucks because I just got the hang of gel manicures and they are so pretty and sparkly.
It's only one finger. Like you only have to use one, and then you put it right back on.
I mean, I couldn't.
That is a really strange.
Fucked up for. So make sure your nails aren't painted, or at least one nail isn't painted.
At least one. Noted.
If you are having foot surgery, remove all nail polish from your toes. That makes sense.
Yeah.
I'm not having foot surgery though. Also, my toes aren't painted.
Also noted.
Leave all valuables and jewelry at home, including wedding rings, earrings, and watches. Wear comfortable clothes. A front closing shirt, flat shoes, and loose pants are suggested. You must wear a front closing shirt as you will have limited shoulder mobility. Remove all body piercings, especially tongue, nose, ear, and ear piercings. You may replace with plastic spacers. So I'm going to be busy. I just put in these two studs too. Ugh. These are my nostril piercings are my newest piercings. And I'm certain that if I took them out, they would be closed within 48 hours.
Right.
So
at least you can put the spacers.
Yeah, and I do have plastic spacers for them, I believe. My lip piercings I can leave out. They'll be fine. I've had them for decades. Oh no. Maybe not decades.
Maybe not.
But
it's none of your business. Moving on. You don't have to explain yourself, bro.
Okay. All right. Yeah. So and then okay. On the day of surgery, please report to the surgical pre-admission unit, SPU, waiting area, room D201, second floor, zone D, orange.
Wow.
Upon arrival, you will be taken to the preoperative holding area where you will change into a hospital gown, socks, a hair cap, and a face mask. You will have an IV started so you can receive fluids and medications. During this time, you will meet your nurses, the anesthesia team, the surgical team taking care of you. When your operating room OR is ready, you will be given medication to help you relax while you are taken to the OR. Like that's fucking real. Like that's
big. That's the biggest.
That's big. Like tell me like you weren't going through that with your head.
Yeah.
You know, like
yeah. Like definitely, especially in the very beginning when you're like, oh, you're gonna get the gown on and then you're gonna lay on the bed.
Yeah, I know. I'm like, oh.
Like, when does my wife have to leave? That's my question. Because
I know. And my mom and Tim are going to be there.
Are they?
Yeah.
That's
my mom already took off work.
No.
Bitch. Surgery takes approximately 3 to 4 hours. I'm going to be unconscious for 4 hours.
And not sleeping. In a different sleep.
I am terrified, Aaron. I am
It'll be like a nap. It'll feel like a nap. You like wake up and you're like, oh, wait a second, what? And
I've been put under I've been put under before. I've had my tonsils removed. That was when I was a kid, though, and I don't remember. But I did have another surgery as an adult. I had a benign tumor removed from my hand, and they told me that I wouldn't need general anesthesia, that I could just do local anesthesia because it was just my hand, and that I would be awake the whole time. But the thought of being awake while I was being cut open, even if I couldn't see it, I asked if I could feel anything. And they were like, you might feel some pressure. And I was like, no, absolutely not. Put me all the way under to take this thing out of my hand. And they all thought it was ridiculous and unnecessary and stuff. And I was like, yeah, you know, well,
you do it. You do it.
Right. Yeah, you do it then.
Lay down.
But I went under and I came out fine. I'm afraid of waking up. But I've never had a problem with that. Yeah, I'm scared of waking up under anesthesia.
You think you're gonna be goofy or?
No, I'm scared of waking up like in the middle of surgery.
Oh, I see. Not like after you're done.
Right. I'm scared of waking up before they're finished.
I see. No.
And though that's never happened to me, and I've been put under several times.
Still a fear. That's okay.
Yeah, it's been a really long time since I've been put under, and you know, there's no reason for me to think that I'm going to have any adverse reaction. And no one in my family has ever had any adverse reaction to being put under. My mom had her gallbladder removed. And you know, we're loopy when we wake up. I remember being loopy. Yeah, loopy as fuck. But that was it. I'm just scared.
That's okay.
4 hours. 4 hours is a long time for them to like maintain the right amount of unconscious, you know? And I know this is their job. Yeah. And I know like the amount, like the statistics are ever in my favor, you know, like it's so rare. And it's even less rare because I know that I don't have a bad reaction with anesthesia.
Right.
But
scary.
I'm an anxious bitch, and this is a major surgery. They're gonna be cutting into my chest.
I want an estimated amount that you think they weigh together.
Oh my god, together, both of them?
We have to estimate.
Oh my god, yeah. And
I'm gonna go off of your number because you have the best.
Okay, wait. Hold on.
I'm gonna guess as well. I need
to know what's about 5 pounds. What's this?
What's 5 pounds? That's a great question.
Okay. Wait. How much does my animal cracker container weigh? Okay, this is 4 pounds. Okay, 4 pounds. Oh. I think together we're looking at. I think we're looking at.
Is it gonna rain?
I'm thinking we're like 8 to 10 pounds.
8 to 10 pounds.
I'm thinking we're like. I'm gonna go. Well, the small one. The small one does weigh less. I'm gonna go 8 pounds. I think 8 pounds.
8 pounds. Okay. It's like a baby. 8 pounds, 3 ounces.
Oh my god.
No, I'm gonna go with. I'm either gonna do 7 or 9. I'm gonna go with 7.
Okay.
Go with 7.
That's a good choice. Okay.
So we'll
give you the results.
We'll have to give you the results in the future episodes. Dude, I'm so excited for you. I'm so happy for you. This is like big. This is huge. Like this is many, many years coming.
Yeah, I've been waiting 7 years for this shit.
7.
And I came out when I was 22. How old am I now? 31. 22. 9. What's that? Do the math. Don't make
9 years.
9 years?
Yeah.
Yeah. So because I came out as non-binary first, I didn't even know if I wanted any kind of hormones and surgery. And once I started hormones was when I was sure.
I didn't either. When I first came out, I didn't want
to. I knew that I wanted top surgery after 2 years though.
Yeah.
I've been waiting 7 years for this fucking shit.
Yeah. Now you're ready. Like,
yeah. So they said surgery is going to take 3 to 4 hours. After surgery, you are taken to the post anesthesia care unit, PACU, where you'll be monitored by a nurse until you wake up from anesthesia. You will wake up with 2 surgical drains, one in the left and one in the right, at the sides of chest. These drains come out in 6 to 7 days during your first post-op appointment in our clinic. A provider will visit you after you wake up from anesthesia and explain how to empty the drains at home. You'll be given a log to record your drain output in your discharge paperwork, but there is also a log on the final page of this guide. Bring this log with you to your post-op visit. See the copy of the drain log on the final page. And there is a drain log I checked. Alternatively, you may record log on your phone. Your chest will have absorbent dressings and be wrapped in ACE wrap. Do not remove the dressings even to take a peek. The dressings will be removed during your first office visit following surgery. You will be discharged home the day of the surgery, typically about 2 hours after surgery is complete, but you may require more time to recover from general anesthesia. There are visitor policy restrictions due to COVID.
Is your appointment after you're released from, so you're released from surgery a couple hours, you're released from the place a couple hours after surgery. Do you have an appointment the next day, or is it like the 6 or 7 days after?
It would be 6 or 7 days after. They said it's either the next Tuesday, or it's either the following Tuesday or the next Tuesday.
I see.
So because my surgery is going to be on a Friday, the next Tuesday is only 4 days. Mm-hmm. So it's probably going to be but then that's a lot of days. I don't know. They might. I don't know. Either Tuesday, they said.
Exciting.
I know. They said, and then after surgery, they go through all of that. When can I bathe? No showering until cleared by a surgeon. Typically, you're cleared 1 week after surgery. You may bathe. I know. I'm gonna be smelly.
Bro, I am sweaty, you guys.
Yeah, me too.
I can't even tell you how sweaty I am, you guys.
Oh, we got the hyperhidrosis.
Yeah, we sweat.
We sweat.
Kayla's gonna be sleeping. She's gonna be walking around with one of those nose plugs on her.
Yeah. Here we get some Febreze.
I'm gonna be having those wipes. They've got like those body wipes. I think I'm just gonna live on those.
They gave me a bunch of these ones, so maybe
use those.
Yeah, for sure. You may bathe from the waist down to not get your dressings wet. When cleared to shower, cleanse the area gently with your hands. Do not rub incision or nipple grafts. Let warm soapy water run over the surgical sites. Mild, unscented soaps are less likely to irritate or dry out your skin, such as Dove, Cetaphil, Eucerin, Aveeno, etc. Pat incisions dry, place Zeroform, yellow gauze, or bacitracin ointment to nipple grafts if applicable. Rewrap with ACE dressing or compression vest. No soaking for 6 to 8 weeks. So no baths, hot tubs, or swimming for 6 to 8 weeks. What can I eat? Yeah, 6 to 8 weeks.
Yeah, I do have a question. I want to know what you're most excited about. Like, what are you most excited to do? Like, after they're gone, what's going to be like?
Oh, man.
What's the one that you're like most looking forward to doing?
Oh, there's a lot. I think I'm most looking forward to just putting on a shirt.
Dressed.
Just get dressed and go.
Yeah.
Just put on a shirt and not have to do anything extra.
Yeah.
That's what I'm really looking forward to.
Yeah.
I've been to the beach shirtless. Like, I know that's going to be great, but I've never just put on my shirt and walked out the door.
Yeah. Never just threw it on and gone.
Yeah. So that'll be nice. Yeah. Once that happens, I'm also, I think I'm maybe not because we're going to be moving, but I had wanted to get like a gym membership. I don't know what that situation's going to be once we move. But there was a gym like right up here, and I just never felt comfortable going.
Intimidating.
And being comfortable. Yeah. Because I know I can wear trans tape and stuff. It's just like, then I'd have to walk home all stinky, or it was just, I didn't want to do it. Yeah. I didn't want to be perceived in the gym with the titties.
Yeah.
So that, I mean, if that's something that is a possibility when I move, I'd like to maybe get a gym membership.
Dude, that's gonna
and just go
amazing.
Places.
Just to
because
go.
It's not going to be like, oh, I can't go because my skin is acting up and I can't wear trans tape. Right. Or, you know, it's my rest day. I just took it off. I can't put it back on.
Right.
Or whatever, you know.
Mm-hmm. Or people are coming over and I can't put it back on.
Right. Oh.
Yeah. I can
like
see
having to plan everything around my application. Like, don't get me wrong. I love trans tape so much. It wouldn't be here without it. Like, I don't want to stress that. I can't not stress that enough, but it's still, you know,
so hard.
It's hard sometimes. And I'm looking forward to one less thing.
Yeah. I mean, that much easier.
It'll be great. And my clothes are gonna fit so much better.
Oh my gosh, dude.
I
have like a section in the back of my closet where it's like ready to go. Like, it's like, these are the ones that I hate wearing now, but like bet they're gonna look good after. Bet.
Yes.
So I have those. I want to make sure and take pictures in them too. So if you have those shirts that you hate or that you hang on to because you're like, I want this to fit me right.
Yeah.
I would do it.
I have all these like tight kind of like you know, I got them in the women's section, like the women's like club section, you know, like so they're like super tight, and like the stuff that I wore at Dinah and stuff. I still wore it with trans tape and it still like served because I always serve, but it's just gonna hit different. I know, because it's gonna be different. It's just gonna be different.
It's gonna be lighter.
Yeah, it's gonna be much lighter. I'm so excited. I'm
excited.
And just, you know, I'm sure being shirtless without trans tape is gonna be a whole new thing.
Yeah. A little more vulnerable, even.
Right. Yeah.
You can't see my nipples when I take my shirt off.
Right. I don't even know what that's gonna look like. Every time I've been shirtless, my nipples have been covered.
Oh my gosh. Yeah. Wait, so you are getting nipples, right? Or you're not?
Yeah, I decided on nipples.
You did decide on nipples. Okay, because I wasn't sure on what you had decided on here.
Yeah, I was really debating between nipples or not nipples, because I was like, I live near Philly. There are so many good tattoo artists around here.
Right.
You know, there are so many good 3D and cosmetic tattoo artists around here.
If you're,
I could get beautiful nipples.
Look this up online, you guys. I didn't know this was a thing, but like 3D cosmetic tattoo of the areola and surrounding area is like fire. Like, people
put the bumps. Like the little bumps that are around people's areolas, the little hair follicles and stuff. They do all of that. It looks, you literally cannot tell the difference.
That really eased my mind a lot for like results. Like, nipples are like a big thing. Like, it matters to me. So I'm like, it makes me feel better that even if a little pigmentation if it's the pigmentation isn't what I wanted it to be, or if it's like distracting or something, I can get that easily. You know, tattooing your nipple, that's a whole nother ball game, but I'd do it if I had to.
Hopefully you'd get a tattoo during the period where you didn't have much sensation.
I would say that's the only period to be. I think you should make a decision soon. No.
Right, yeah.
I don't know. I'll definitely let it heal all the way.
You could also, there are also people who do tattoo color correction for scars.
Mm-hmm. Ooh, I see, yeah.
So if you end up having one of those darker scars and you're self-conscious about it, and you could always get it tattooed. There are people that do that and they do it really well. They match your skin like seamlessly.
Yeah.
So
it's art.
It really is. It's beautiful.
Yeah.
So there are definitely options.
Yeah.
Or, you know, if maybe your scar meets in the middle and you don't want it to, just have a little.
Oh, I see what you're saying.
You know, break it up.
Yeah.
Even if you don't want to get the whole thing tattooed, maybe it goes too far to the side or something. Just fucking get a tattoo.
I like it. I like that. That's a good idea.
Yeah. I think a lot of people don't consider that as an option.
I didn't think. I mean, this is new. Like this, there's a lot of new revelations that are coming out about different things and more education and more, just awareness. There's more research being done. So we're definitely learning more and more.
What a time to be alive. What
a time, especially for the trans. I feel that in this area.
Okay, so it goes on to say what I can eat. So it says to increase protein in your diet to aid in healing. I didn't know that. Avoid alcohol. Obviously, but maybe not. Avoid caffeine. Aaron, avoid caffeine. One 8 ounce cup of coffee is okay.
Okay.
They said no straining for bowel movements.
All right.
Can't strain.
All right.
Eating fresh vegetables and fiber along with walking and drinking plenty of water will aid in regular strain-free bowel movements. However, we will prescribe medications to make bowel movements easier. Take if needed. You will be prescribed Colace to take twice daily for constipation. You can get milk of magnesia at a drugstore if you need something stronger for constipation. Alternatively, you can take Miralax daily along with Senna or Dulcolax. How should I sleep?
Oh no.
This is a big one, Aaron.
Because we're both belly sleepers, aren't we?
Yes, we're both belly sleepers.
That's a problem.
You are advised to sleep supine, which is on your back, with some pillows slightly elevating the chest position for the first 4 to 6 weeks,
bro,
after surgery, bro.
Oh, there would be times that me and Kayla will fall asleep watching TV and she's like laying on my chest and I'm like, I stay half awake. Half awake. And then eventually I'm like, okay, it's like it's a common terminology. I have to flip. Like once I flip,
I do the same thing.
Once I'm flip, it's over. So like, I feel like I'm going to be like half laying there, just half awake for 4 to 6 weeks.
Yes, dude. That's what it's gonna be.
What about like a weighted blanket on the chest?
Well, it says you want to avoid prolonged pressure to the chest as it heals. This prevents asymmetrical healing and also protects the nipple grafts if present.
Defeats the purpose. Yeah, that makes sense.
Yeah. But I mean, there are mastectomy pillows that like they're not weighted, they're just like pillows for you to put there. And that was one of the recommended things that everyone was telling me to get.
Even just to have like the sensation, at least.
Yeah, like just to have a pillow there. And also like if you cough or something or sneeze, you're supposed to like hug a pillow so that you don't like pop a stitch or something.
Oh yeah,
because it's on your chest, that's why. Also breathing is important, and they want you to do like this breathing exercise with the spirometer.
Did they include like scar care in your packet?
Yeah, they did. And that's actually the next thing. How can I take care of my incisions and nipple grafts? Swelling and bruising is normal. This can take 6 to 8 weeks to resolve. Place an ice pack wrapped in a towel to the area for 20 minutes on, 40 minutes off, as needed for pain and swelling. Ice packs are usually helpful during the first 2 to 3 days after surgery. Discharge/drainage from the surgical area is normal. You may notice brownish, reddish, clear, or yellowish drainage. Some may notice bloody discharge coming from one or both nipples around 1 month after surgery. This is normal. With any skin graft, 100% of the graft does not adhere successfully. When there is a small gap between the nipple graft and the chest wall, the body fills the gap with what's called granulation tissue. Granulation tissue is healthy tissue, but does tend to bleed, sometimes causing bloody discharge from the nipples. This will resolve on its own within a few weeks once the granulation tissue heals. Yeah, that's rough listening to, isn't it?
I guess we will definitely have no sensation at that point.
Yeah, no. I
So
mean,
it won't be like
we'll feel pain.
These nipples, like it happening to these.
Right. Exactly. You won't be feeling the bleeding that's coming from your nipples.
Right. You'll just
be in general pain
look a little
around.
gross.
Yeah.
Yeah.
The whole chest is gonna hurt.
Yeah. Bro, I cannot tell you how happy, because I'm a couple months behind Beau probably. So I'm super thankful that we're like going through this at the same time. Like all of your concerns, like I'm having the same concerns. And like, even if they're just our dates are just a little bit apart, like I'm so thankful that your time is also during my time. So we can share.
Yes. And it's you started before me, and you had a hiccup with your surgeon, and now you're looking for a new surgeon. So it was really you getting your shit going that was like, okay, bet I need to get my shit going. And then it just worked out that now I have a date. And
yes,
I'm glad that it's happening this way too, because if it was the other way around, I'd be like, Aaron, read to me that packet.
Right. Give me everything. That's why I'm asking all the dumb questions.
Yeah,
I'm thinking too.
Okay, so then it says stitches. Stitches will dissolve on their own after a few weeks. Any stitches that do not dissolve will be removed in the office. You will also have steri strips and/or glue over the sutures at the incisions at the bottom of your chest. Let these fall off naturally and do not peel off. You may trim any loose ends with scissors. Dressings. After your first post-op visit, you will start daily dressing changes to nipple grafts. This includes applying
Wait. I'm sorry,
when after your first post-op appointment,
okay,
you will start daily dressing changes.
Okay, all right, I got you.
And your first post-op appointment is 6 to 7 days. Yeah.
Yeah, okay. All right.
Well, you have to take everything else off to get to the nips, so.
Oh, okay, I'm ready. Okay, keep going.
This includes applying zero foam, antibiotic yellow gauze, or bacitracin ointment to the nipple grafts. Place non-adherent gauze over the nipple grafts and rewrap with ACE wrap or compression vest.
Which are you going to use?
I feel like the compression vest is just going to be a better idea.
It just makes more sense. I feel like ACE bandages were before binders, and now we have binders and trans tape as both an option. But in this situation, I feel like the binder would be more beneficial than the ACE.
Yeah.
I'm thinking binder for me as well.
Yeah, because then I could just, instead of having to, then Tim would have to like wrap around my whole body with ACE bandage.
Yeah, that's true.
And then he would have to control the pressure
in the center.
Yeah, they include a link to one in this packet for Amazon that you can get on Amazon for $23.
Okay.
Yeah. So, it says compression wrap. You will wear ACE bandage at all times for the first 3 weeks after surgery. After 4 weeks, you will wear ACE wrap either all day or all night for another 3 weeks. After that time, you can forgo compression wraps. ACE elastic bandages are best for chest compression in 6-inch width. That's what it says. And then here is where it has the...
Yes, I see.
The binder. It says this vest can be found on Amazon and costs $23. Search Zuji Zip chest binder, and Xuji spelled Xuji. And so then it tells you, how do I empty my drains? Oh, Aaron.
Okay. Pause. Let's pause there. How squeamish are you, Beau?
No, I can read it.
No, I'm asking for like recovery core. I mean, I'm curious.
So like for when I have to empty my drains?
Yeah, like
I'm very squeamish.
Dude, me too. And it's embarrassing. Like, I wish it wasn't like, but like even as you're reading, I'm getting like goosebumps. I guess it's just because I can like kind of feel it, you know?
Yeah.
I don't think it's gonna gross me out as much because it's mine.
I want to hope so much that is the case. But I am just not sure.
I'm not sure.
I told Tim, I was like, I'm going to try my best to be able to be the one that can do this.
Yeah.
But if I can't do this, you have to.
We're going to need to get this done. Like I might need to call you in from the bench, bro.
Right. You might have to choke it down, buddy, because I can't puke. So,
right.
These stitches, I can't be heaving, That's
not an option.
Right. So, here we go. You will be discharged home with one drain in the left and right sides of your chest. The flat end of the tube is placed inside your body so that it can collect the body fluid that is produced as an effect of surgery. Serous fluid and blood mixed together is called serosanguinous fluid. The drain is designed to collect this fluid by way of suction. The drains help reduce the risk of infection and seroma, which is a buildup of fluid in soft tissues. You will empty your drain twice daily. Empty more often if your drain is over 50% full, as the suction ability will stop working if too full. Steps to emptying drains. It gives a little picture
of our drains. Okay.
Yeah.
It looks like it's pre-labeled with the measurements though. Remember how we were saying?
Yeah, on this bulb it is pre-measured with the measurements.
Yes. Okay. So you don't have to like pour it into a cup and like use the one from the kitchen
well hold on. Here okay. It goes. Here's what it says. Step 1.
Here we go.
Wash your hands.
Right. Of course.
Step 2. Strip tubing if blood clots are seen in tube. And this is how you strip a tube.
All right, here we go.
Grasp tubing close to the body with one hand and hold toward body so as not to pull on the sutures. With the other hand, grasp the tubing below the first hand. Pinch the tubing tightly, sliding fingers down tubing away from body. Repeat 2 or 3 times. Be sure drainage is flowing into the bulbs. So you like grab it and then you pinch it and you slide it down. And just
slide.
Gross. Okay. So strip the tubing if blood clots are seen in the tube. Pull the stopper out of the bulb. Pour the fluid from the bulb into a measuring cup. Cups will be given to you after surgery.
So you don't have to use one from the kitchen?
You don't have to use the one from the kitchen. They're going to give you measuring cups to use that you then have to fucking pour.
I'm confused. Why can't the bulb identify that for me?
Maybe because it's bulb shaped. I don't know, Aaron.
Bulbous. All right. Well, I'm going to ask.
Maybe it's so you can also like check the texture of it as it pours.
Oh,
I don't know. Even just saying that sentence
the density,
me out.
Like phlegm level.
Ew, disgusting. Density. How dare you? That is foul. Oh my God.
We are just sharing our honest. These are our reactions. Like, I'm sure a little bit longer from now, you guys can click ahead and see how our surgeries actually went. But right now, we can't click ahead and see how our surgeries went. So we're going to share exactly what the fuck we think because
this is
real.
What we have. The sacred text of this packet.
And my packet will probably be, I'm just going to hope my packet says the exact same thing. Otherwise, it'll be a question.
Right. Yeah. We got to go over what your packet says and like compare notes and make sure it's all the same. Okay. So Yeah, measuring cups, right. Squeeze the bulb flat. While the bulb is flat, put the stopper back into the bulb. The bulb should stay flat after it's plugged so that the vacuum suction can resume. Write the amount of drainage in your drain log chart, which is in this packet. Discard the fluid into the toilet. I'm glad they said toilet because for some reason I thought I'd be washing this shit down the sink.
For some reason, you're like, oh, smart toilet, right?
It's going back into the Philly water supply. Let's do it.
Filter.
Okay. How much can I move around? Can I drive? Walking is good exercise, but do not walk to the point of feeling very tired, lightheaded, or short of breath. It is normal to feel more tired or fatigued as your body heals. Be patient with your body. Take your time and rest as needed. As you become more active, you will notice more swelling and soreness. No strenuous activity or heavy lifting. What's that? Oh, fuck. My brain cell broke. Is that greater than or less than? Less than. It's less than.
What's it eating?
Because it's the bird. The bird is eating it. So.
Oh, okay.
Okay, so no
alligator.
strenuous activity or right. It's the bird. It's the bird. So it's less than 10 pounds for 6 to 8 weeks. You may resume your normal exercise routine 8 weeks after surgery.
Which
so
is
that's
nothing.
2 months, right?
Which is non-existent.
Oh my God. Like this whole time up until they said you can resume your normal activity after 8 weeks. I'm like, oh, that's just 2 months. But this whole time I'm like, 4 to 6 weeks I have to sleep on my back. That's forever.
At the exact same time.
That is so long.
That's so good though, because like your recovery time for when you're moving is going to be big.
Yeah. February, March, April. I'll be ready to go by April. We're not moving till June.
Exactly. So you'll have
So
like extra.
Good. Yeah.
That's good. I'm liking this, dude. What's our next step here? Your next step. What's your next step in your top surgery journey here? You did your labs.
Yeah, no, literally. Okay, so I scheduled one last appointment pre-surgery. It's called the
pre-op.
What's it called? It's not. It's
pre-op.
Something. Pre-admission surgical appointment.
Yeah,
it's called the pre-admission surgical appointment, where they're going to do an anesthesiologist consult, blood work, medication review, an EKG/chest X-ray, and this is all just to make sure that I'm healthy enough to undergo surgery.
Right.
So,
so that's
fingers crossed. My chest X-ray and EKG comes back hunky dory.
When is that?
What?
When is that scheduled for?
Monday
at
12:45. Yes.
A couple days from now.
Yeah. So I'm gonna miss the meeting on Monday.
Oh well, that's okay. This is
I'm
the
gonna
time.
have to tell everybody. Yeah.
That's the time to miss it right there. Holy crap!
So then after that, literally all I can do is wait until the day before surgery and wait for the phone call that they give me telling me what time to show up the next day.
Yes.
Which is likely going to be in the morning.
Likely. Yes. So we probably will have a break. We probably will have it give Beau a break of our recordings for that week. So this is going to be good. I'm excited to hear how it goes. I'm excited to see how it goes. You know, I'm going to talk to you every single day. And I am just so fucking pumped for you. You just deserve it. And I think next week, we'll definitely still be able to film. So that would be nice.
Oh my God, we'd be filming the day before surgery.
If that's what you want, bro, that's your call. That is totally your call. We will.
Not next week, but the following week. Because we record on Thursdays. So next Thursday would be for sure. But then the following Thursday we'd be recording the day before surgery.
Yeah. Well, we'll see if that's up.
We'll see.
We'll see.
We'll see.
But for now, check out our other episodes 1 through however many we're at now. We're starting to get a couple under our belt now. We got a good pace.
At least 5.
Yeah, we got a good pace going. Actually, I know it's 6 now that I'm thinking about it. Yeah.
Nice.
So we're gonna start dropping every week on Sundays. So make sure you're listening to us anywhere you listen to podcasts. Follow us on social, and stay tuned for more of Beau's top surgery journey.
Woo! Oh, look at the merch.
Oh yes, we are also working on merch. This is a new development that we are undergoing, and it's gonna be badass. We're gonna try and get you guys some dope merch that if you want. We got matching tattoos of the podcast logo. If you haven't heard, these are the real deal, real tattoos we got by a real amazing trans artist in Boston. Jinx.
Salem.
My God, Salem.
Yeah, Salem.
And
respect on his name.
I'm so sorry. My bro. I'm trying here. We'll get it out to you. And yeah, thanks for listening. We love you.
Thanks. We love you. Bye.
Bye.